Next speaker is Dr. Adul Tadani.
My topic of today's talk is role of interferon alpha therapy in BDM case. So this is a patient of 75 years old Asian male which presented with the symptom of blurring of vision since 2 to 3 weeks. He is known case of metastatic lung carcinoma which was detected in August 2021. So brief intro about that patient. He had undergone lung biopsy followed by 1 cycle of chemotherapy, and after genetic mutation analysis he had PD1 testing score positive and EGFR negative, for which he had undergone 4 cycles of immunotherapy with pembrolizumab, and at the end of the cycle, after 10 days he developed blurring of vision at the end of 4th cycle. So on fundus examination, patient had multiple neurosensory detachments and multiple pigmentary clumps which was seen. On OCT and FAF was done. OCT showed localized serous elevations temporal to the macula and with few choroidal folds, with pronounced RPE abnormalities which were seen in FAF with scattered hyperreflective spots. On fundus fluorescent angiography, there were multiple mottled hypo with hyper fluorescent spots which were seen. These with fundus findings like multiple orange red geographical patches which are seen in giraffe skin pattern, along with confocal findings which were pigment clumps which were seen, and FAF findings and OCT findings, along with ACTAP which was done in this patient with pigmented melanocytic cells which were found. BDM was confirmed. So on treatment, we stopped the immunotherapy and continued the chemotherapy along with the steroid, systemic and oral steroids with anti-glaucoma medications which was there. And for the SRF, we used one trial of anti-VEGF in both the eyes, but no response was seen. So patient was started on interferon alpha therapy, which was given after the ethical committee approval. So on OCT comparison, from after 4 weeks of this interferon alpha therapy, the SRF was completely resolved and the swelling was completely gone. So cytokine biomarker analysis of this patient also showed the decrease in MMP9 levels and IL-1 beta, ICAM, and IL-17A and TNF alpha levels. But at the end of the this treatment, VEGF level was again increased. So on discussion, there were multiple treatment modalities which were available and which were used, but with variable results. So like in Rahimi et al., they used ocular radiations, SRF drainage, and corticosteroids. Plasma pheresis has also been used in some patients with variable results. BDM is a hallmark of grave systemic disease, so requires high suspicion and prompt evaluation is required. Complete resolution was seen in our patient after interferon alpha therapy with after 4 weeks of usage, and resolution in MMP9, IL-1 beta, ICAM, and IL-17A and TNF alpha was also seen. So because this was best to our knowledge, there was no case reported with interferon alpha in this refractive edema in this BDM patient, so we presented this. Thank you.
Thank you. Great presentation. You want?
What is the literature on this? You said there are no cases at all. So how did you think of
no literature on usage of interferon alpha? So we think it can be used in this cases, but because the mortality rate is very high, the poor survival rate is there. So patient do not reach that. Some patients usually don't come for this also. So sometimes the patient was actually stable overall physically. That's why he was coming for the follow-ups. Otherwise, usually patient don't come for this also. So it's
any other biologicals, Humera, Adalimumab,